Good afternoon and welcome to the School of Medicine's Education and Research Programmes webinar. I'm Ursula Milan, the Business Development Manager for the School of Medicine, and I'll be introducing our course or programme directors for their presentations as we go. If you have a question, please include that in the chat, and we'll do our best to answer them online. But I'd also like to thank my educational health science faculty colleagues of Lynn O'Doherty and Sinead Liston for organising this event, and they will be monitoring the chat with us. I'm going to start sharing the slides, and I will now hand over. And just for your information, you can find any details you need on our programmes on this link here under ul.ie/ehs/medicine/programmes. And I'm handing over now to Roisin Doog, who is the course director for our BMBS Graduate Entry Medicine. Thank you, Roisin.
Thank you, Ursula, and good afternoon, everybody. And thank you for joining us for our webinar here at lunchtime today, just to give you some information on some of our courses in the School of Medicine. So delighted to have you on board with us. So I'd like to talk to you today about our BMBS postgraduate program. I'm course director of that program, and it's a program that we are really proud of, and our students get such great value out of studying medicine in UL. Some really strong points just to talk to you about in this program. It builds on international best practice, and we integrate our basic and our clinical sciences with our hands-on meeting patients, early patient contact, and with the clinical years. So it provides our graduates a great opportunity to come out with their medical degree feeling very confident in meeting the patients as they start their careers as junior doctors. Our program works off a basis of problem-based learning, and it's something our students really value, because from the day they start in our medical school, they talk about the patient case, and their learning is through the lens of caring for patients. So in year 1 and year 2, a lot of the theoretical learning happens, but in year 3 and year 4 there's a lot of clinical exposure, and that's where this type of learning really helps the person, because the patient is to the forefront of everything they do. And we really see our students excelling compared with some other schools where they have different approaches to learning. Our emphasis is on a very strong community orientation, and as part of that, we have a longitudinal clerkship in general practice, where you have a unique opportunity to have a one-to-one relationship with your tutor, and a great opportunity to develop your skills, where you become very expert over that length of time in your basic clinical skills. It's very self-directed and with defined educational outcomes. And our assessments both look at formative and summative assessments appropriate to your journey as a medical student. There's a robust approach to the course evaluation and to quality assurance, and we've been accredited just this past year by the Medical Council again for our programme. Next slide. The course suits people who are highly motivated, who are excited by learning, who are able to be self-directive and are inquisitive about knowledge and about learning. It's very interactive, and especially our problem-based learning. You learn together as a team. You work together in life as a team. So being a team player is really, really important. It really supports people who accept assessment as a means to an end, rather than just concentrating on the initial results and those results. So it's really important that it's building your education, your career for life, and it sets for you lifelong learning. Because as a medical graduate, you're going to be learning for the rest of your life, and this is a great place to start that. Next slide. It's open to graduates of any discipline, and that's something we really love in UL. The fact that people come from lots of different disciplines, from business, from healthcare, from arts, from law. Our students cover all of the different areas. You must have a minimum of a 2-1 in your first degree programme, and a GAMSAT is required. In years 1 and 2, as I said, it's highly structured. We look at hypothetical clinical cases, we look at knowledge of health and illness, and we look at your skills, your professional competencies. And then years 3 and 4 are very much based on the clinical years, your placements in general practice and your placements then for medicine, surgery, and all of the other disciplines. We'll be delighted to take any questions that people might have regarding our course and if you have any interest. And again, on the website, there's a lot of information there on it. Thank you very much for your attendance here today.
Thank you, Roisin. I'll now hand over to Dr. Lucy Pollard, who's our course director for the new direct entry medicine.
Good afternoon. As you said, I'm Lucy Pollard. I'm the course director of this new program, and I'm genuinely excited. I'm really looking forward to receiving our first cohort of students in September. You've heard a lot about our existing program in graduate entry program, so you probably understand what makes our medical program so strong, but I think I need to reiterate because it is really an exceptional program that produces exceptional graduates. It's designed to ensure that when our students graduate, they are really confident clinicians. And so we've designed this innovative and integrated curriculum that really emphasizes those practical skills and that lifelong learning sort of desire to learn more. Medicine changes all the time, and students need to keep up with changes in therapy, treatments, new diseases as they come along. In order to ensure that our graduates are ready when they finish, this emphasis on problem-based learning that you've already heard about actually means that students really do think outside the box, and their approach to cases is very different. We see that when our students go out on placements, because they're not just memorizing facts, they're really learning how to apply the knowledge. And we see that when our students go into the clinical placement, we have, as you can see, some excellent clinical partnerships. And our students stand out from other medical students because of the way they've been taught to think. We also know that our graduates are internationally recognized. We recently had a visit from the Medical Council of Canada, and they praised the graduates that leave us and go back to Canada. And beyond the academic aspects, we have a really vibrant campus environment with a strong sort of support from staff across the piece. Next slide. Our program has been developed so it's in 3 stages across the 6 years. Stage 1 is really about building that foundation in medicine. This is where students will build their knowledge of the biochemistry and the biomedical science, finding out how the cell works, how that integrates with other parts of the body. And in that first year, we talk very much about the basic science blocks, but as you move into the second year, you'll start applying that science to health and to disease and taking a much more clinical approach to that basic science. You'll also learn about the structure of the body in anatomy classes, and we use state-of-the-art technology to enable students to learn through virtual dissections of the human body. We also want our students to start developing a strong professional identity and mindset, the values that students need to be clinicians, the communication skills that they need. You know, students need to think back to how their own experience as medicine have been shaped by early conversations with doctors. And as I said before, we really want our graduates to be lifelong learners. Stages 2 and 3 is where the program starts to mirror that of the GEMS program that you've already heard about. So there's more integration of science and clinical practice. There's more emphasis on early patient contact. And then in the final stage, students are really in their clinical placements and building up on those skills to transform patient and population health. Next slide, please. So what do you need to apply? Applicants really need to have a strong basis in science. The requirement is only for one science subject, but if students have biology and chemistry, it probably is a plus in terms of some of the science that they'll be developing and learning in their first 2 years. We also expect applicants to complete the HPAT, and it's quite an intensive test. It's the Health Professions Admissions Test, and it's used across medical schools in Ireland. And there are practice tests, and there's an ability for students to learn how to do that. Minimum points are 480 points from the same sitting of the Leaving Cert, and point scores above 550 will be moderated, but both the subjects and the points must be achieved in the same setting. Again, if you have any questions, we'd be happy to answer them. And thank you all again for your time. And yeah, if you're passionate about medicine and you know, I think this program combines innovation, clinical exposure, and really strong support.
Thanks a lot, Lucy. More information there on either the link on the website or the email addresses on the invitation. I'll now hand over to Mary O'Neill, our course director for paramedic studies. Okay, Mary?
You're muted there, Mary.
It would help if I turned on my mic. Thanks for the introduction, Ursula. As Ursula said, I am the course director of 2 paramedic degree programs here on offer in the School of Medicine. The course codes are there on the right of the screen, LM103 and LK056. The focus of this session really is on LM103, which is the 4-year program, which is available to all applicants. LK056 is only available to registered paramedics, and it encompasses years 3 and 4 of LM103. So the structure of the program, students are on campus here in first year. They spend semester 1 on campus here in our new facility in Park Point. There's a picture there for you, on the Dublin Road near the Travelodge. And in semester 2 of year 1, students go on taster placements as part of those modules, where they spend time with the National Ambulance Service in a variety of placements across our hospital sites. For example, mental health placements, maternity placements, A&E placements, CCU, etc. There are several of them. So in year 2 then, because this program has a dual award, our students are required to take a 52-week internship. So students work with the National Ambulance Service in year 2 of the program. This is a paid placement and they earn somewhere around 30,000 plus plus extras or subsidies. So that's year 2. In year 3, then students come back on campus. They are qualified paramedics at the end of year 2. So they have received a paramedic license at the end of year 2. And as qualified paramedics, they join the practitioner entry program LK056 in years 3 and year 4. This portion of the program is structured so that students may work and study at the same time. There is 1 week on campus per semester. The rest of the teaching and learning is facilitated on our virtual learning environment, Brightspace, where students can submit assignments. We can submit resources and meet students regularly for tutorials and one-to-ones to scaffold their learning. So the entry requirements then, some of them, they're fairly standard across all programs in UL in that you must achieve 4 H7s or 2 H5s and 4 O6s. The subjects that are required, again, are standard across programs in UL. Just to note that if you do have an Irish or a language exemption in secondary school, that does carry through. You also need to have a science subject, so an O6 or a H7 in either biology, physics and chemistry, or ag science. There is a QQI route approved for the last couple of years, so we take on average about 4 students through a QQI route. And the list of major awards that are acceptable are available on the CAO website, where paramedic studies have their own page. I think there are 8 major awards, and you must have distinctions in 5 distinctions from 6 of these. There's all the next way to come on the program is via a mature entry route. Again, applying through the CAO and an interview process then to select students from that route. Specific to our program, we also require students to present or applicants to submit a full B license and a provisional C1 license. It's worth noting that in order to attain a provisional C1 license, candidates must be 18. Must also successfully complete Garda vetting and an occupational health assessment. I just have put a picture there of our new facility in Park Point and want to mention that if anybody would like to come visit us, to please email paramedicstudies@ul.ie and we will show you around. And there's lots of information also on our website pages. Thanks very much.
Thank you, Mary, and I'd echo Mary's comments there on PowerPoint being a state-of-the-art, brand new facility for paramedicine, and we're really excited as to what it'll allow us to do going forward. Thank you, Mary.
Thank you.
I'll now hand over to Dr. Amira Maddy, who's the course director for our biomedical science degree. Over to you, Amira.
Thanks, Ursula. Yeah, as Ursula said, my name is Amira. I'm the course director of Biomedical Science, which is a Bachelor of Science specialization we have here in the School of Medicine. So we can go on to the next slide, please, Ursula. So we introduced the Biomedical Science course about 5 years ago now, and I suppose the aim is that we really wanted to produce skilled graduates who really understand the importance of working partnerships between scientists and healthcare professionals. So we see biomedical science, like in this diagram here, it really sits at the center of healthcare. And we know that when we're faced with challenges in healthcare, you know, healthcare professionals, doctors, nurses, industry, scientists, and patients, they all have to work together to really tackle these challenges. However, it can be, you know, challenging to translate between all these different sectors. And that's where we really want our biomedical sciences students to stand, to understand the needs and the interests of all these different stakeholders and really help us to tackle these challenges. So within the course, we study things like anatomy, physiology, disease, and pharmacy. So if these are things you're interested in, it'll be a good course for you. And really our kind of aim is to look at human health at the bench side. That means like looking at health in the lab and doing experimental work. At the bedside, so taking into account patient factors, you know, adverse effects on patients and things like that. And also in the community, so looking at disease prevalence within the community, looking at how people use healthcare resources. Next slide, please. So how do I get into biomedical science? So at the moment, it is a final year or fourth year specialization of the LM123 Biological and Chemical Sciences course. So this is our common entry science course at UL. And it's a really great course if you're in secondary school at the moment and you know you really enjoy biology and chemistry, but you're not exactly sure which area you want to focus in on and specialize in on just yet. So the last CAO points for that were 484. Then what you need to do is once you've entered that course is in years 2 and year 3, take the bioscience route. So this will be focused in on things like cell biology and biochemistry. Then after year 3, we go to all the third year bioscience students and we give them the option to transfer into the School of Medicine for this fourth year biomedical science specialization. After the completion of all those modules, the students move to our School of Medicine and they graduate with Bachelor of Science in Biomedical Science. So within this, we have teaching from lots of different healthcare professionals, such as doctors, pharmacists, medical scientists, radiologists. So you get a very specialized look at biomedical science from a more clinical side than you may get from other courses within the University of Limerick. Next slide, please. And a question we get a lot is where do graduates go after biomedical science? So really, there's a huge range of things you can go into after biomedical science. You're going to get experience of going into the hospital and seeing what happens in hospital laboratories. You're going to learn from different kinds of doctors, from GPs, from oncologists. You're going to look at radiology. You're going to meet industry leaders, present to industry, and you're also going to see a lot of research and meet people who've gone into PhDs or other research roles. So that's reflected in where our students end up. The majority of students do go into industry, so we have a lot of strong industry connections, particularly in the Midwest. And all the students as well within their third year of this course will be doing a cooperative placement usually in an industry company in Ireland or abroad. We're also seeing a lot of our students going into our graduate medicine course in UL. Some people go abroad as well, and they find that the basis of learning that they've been introduced to in biomedical science, focusing in on anatomy, physiology, but also looking at the patient side of things really does help them when they move into the graduate medicine course. We've also had a lot of people go into research, whether that be a master's degree or a PhD. And again, this is because they get a lot of experience in research during the course, particularly through their final year project, where they can meet a lot of different researchers, professors within the School of Medicine, and then some people go on to do PhDs with them. We've also had people go into radiography, so that would be a specialization master's afterwards, because we do go into the radiography departments in UL, and some people find this really, really interesting. And we've had a number of people now go into work in hospital laboratories as medical lab aides, hoping to qualify in medical science as well as they build up their work hours required for that. So if anybody wants any further information, they can contact us at biomedicalscience@ul.ie. And if there's any questions as well, you can pop them into the chat and we'll be sure to answer them.
Thank you, Amira. Very comprehensive. I'm now going to hand over to Dr. Mohammed El Hassan El Sayed, and he is going to take us through the Health Professions Education. Thank you, Mohammed.
Thank you very much, Ursula, for the introduction. I'm Mohammed Hassan El Sayed. I'm the course director for the Masters in Health Professions Education at the School of Medicine. Next slide, please. The Masters in Health Professions Education aims to build the graduate as effective healthcare educators. So you are going to work mainly in the area of medical education, health professions educations, and how can we educate health professionals. It's a 2 years part-time program, and students can have the choice on having either the fully online distance learning program or the blended learning formats. It is designed for those who work in healthcare as healthcare professionals, and mainly designed for those who are busy working in hospitals and other places. It's flexible learning and asynchronous learning, and the students have the chance to interact with the faculty members and to collaborate with their colleagues. The course is accredited by the Academy of Medical Educators, and we are proud that we are the only course that is accredited by the Academy of Medical Educators in Ireland. And that accreditation will allow the graduates to apply for the membership of the Academy of Medical Educators with short track route. Next slide. The key features of this program that, as I mentioned, you can choose either between the fully online or the blended based on your status of work and your business. And also this program is fully research-led. So all teaching is led by research, and also we would like to help our students to apply the research results on their work. This course is interprofessional because we have people from all professionals. We have doctors, we have nurses, we have physiotherapists. All of them, they work together, and they have the chance to learn from each other and with each other. We use innovative teaching, such as discussions and authentic learning techniques, and we hope that we give the students the best that we can in teaching and learning in health professions education. Next. The course is 2 years. The first year, students are learning about learning and teaching in health professions education and how can they support the students in healthcare, and also about assessment and curriculum development, and definitely they have to study about leadership. Year 2 is whole devoted for research. In the first semester, they study about research in general, and then they do their dissertation in the other 2 semesters. Students can exit with postgraduate diploma if they finish 60 credits out of the 90. Next. Yes, can I study and work full time? Yes, most of our students are full-time professionals, either, as I mentioned, doctors or nurses, and because we deliver the modules in blocks, so each block is around 6 weeks, and all the content will be available from the beginning, so students can learn on their own time. And because the first 2 in the first year, we introduce the research-led teaching. So in year 2, they will be ready to do their research, and that will help them a lot in conducting their research. The scope of the research usually will be something that they are doing. So the teaching that they are doing, the work and teachings that they are doing, and they will be supported by 2 academic faculty members, and those will help them a lot in doing their research. So all the help that we can give to those who work full-time is given, and most, if not all, our students are full-time professionals. And again, we give the students the choice when they do their dissertation. Either they can provide the publication-ready manuscript or the traditional monograph. So the flexibility in the program is designed so that the students can choose according to their work business. So for further information about the course, you can go to the website, and if your questions were not answered, you can email us at mschp@ul.ie, and we'll be ready to help in answering any question. Thank you, Ursula.
Thank you, Mohammed. It's an excellent program, and there's loads of information available there on those links. Thank you. I'll hand over now to Dr. Maria Rura, who is our course director for our Masters in Public Health. Over to you, Maria.
Hello, good afternoon, everybody, and thank you, Ursula and Lynn, for organizing. I'm Maria Roura. I'm the director of the Master in Public Health. We can move to the next slide, please. This is a full-time program. This is a 1-year full-time program, and very important, it is delivered on campus. This program is organized in 5 core modules. These are teaching modules that take place between September and March, and we are covering topics like health systems, health policy, global health and sustainable development, public health research and data analysis, and monitoring and evaluation of public health interventions. We are inspired by all the work of our colleagues in the School of Medicine working using a problem-based learning approach, and we have a case study approach. I would say this is the flagship of this program. For all the teaching modules, we use case studies where we work in groups with students, supporting them to apply the concepts that we see in class to real-life scenarios. And I would say this is an added value of this program that really makes us different from other similar programs. We then have in March a practicum that lasts 8 weeks, and then we have a research project between May and August. Very important, the program moves really from a traditional teaching approach to a competency-based approach. And in the next slide, I would like to show some examples of how we are working. We conduct a lot of participatory exercises. The picture below shows you a little bit the multicultural composition of our students. We use card storming exercises to work together to think, in this case, for example, about the differences and similarities between quantitative and qualitative research. So a lot of hands-on workshops, a lot of interaction, a lot of emphasis on teamwork, and also a lot of emphasis into really comprehending the complexity of what public health is. We don't want to have simplistic approaches or magic bullet solutions, because this is not at all possible in public health. What we want is students to think critically, to think about the complexities, the multiple entry points, and as you can see in the example, systems thinking. We put a lot of emphasis into understanding really the multiplicity of determinants of health, not as an additional challenge, but as an opportunity to identify all the different entry points to develop public health interventions. So if you have more questions, you can go to the links, and also to note that we interview all eligible candidates, because we want to make sure that they have an adequate level of English. and also an adequate insight and motivation for our program. So we interview the candidates, and also in terms of assessment, we do have assessments for critical thinking at individual and group level, but we do also have on-campus examinations, traditional pen and pencil closed book examinations to make sure that the key concepts have been addressed and attained. And that's all from my side. If you have any further question, I will be happy to answer.
Thank you, Maria. A very interesting program, and as you say, very much multicultural with an extremely high percentage of international students. I'll now hand over to Dr. John Salzberg, who's the course director for our Participatory Health Research Professional Diploma, one of our short level 9 programs. So over to you, John.
Thanks, Ursula and Lynn, for putting this together. Welcome, everyone. Thank you for being here with us today. I guess go on to the next slide. So my name is John Salzberg from the School of Medicine, and I'm the course director for the Participatory Health Research Professional Diploma. And what this is focusing on is the skills around being able to involve patients and other members of the public as co-researchers within whatever research that you're doing. And as you heard earlier from what Amira was saying, for instance, in the biomed sciences, that patients, not only in the management and delivery of care and services, but in the actual creation of the evidence that is going to be used to build treatments and interventions and therapies for patients. In all of those scientific bases, the patients in Ireland and just about every other jurisdiction, such as the UK, the United States, Canada, Australia, most Western European nations, health funders are demanding that patients become partners with researchers and clinicians in creating this evidence that is going to structure their own health. So what this professional diploma is aiming to do is to build these skills on how to actually partner with patients and members of the public as co-researchers within your research, within the research that you're doing. So, and because this has been shown, as we said here, improving the research questions, it supports recruitment into studies, helps identify results, it promotes change in policy and practice. It really makes sure that the evidence that is coming out of the research process is much more applicable to the actual patients and the patient's need than if they weren't involved. And our evidence is showing that that is in fact the case, and that is why most health research funders are demanding that there is some involvement of patients throughout the entire research process. So what we want to do, if you move on to the next slide, thank you, is provide training that is going to allow existing researchers and clinical researchers, but also students who are going through, who have already done their basics in research. So someone who's graduated with an MSc, with a BSc or an MSc in basic sciences or in research already, and knows the basis of research, but doesn't understand necessarily all the means of involving patients and other members of the public as co-researchers. That is our target audience who are trying to get into this. So this is a 1-year part-time, level 9, 30 credit program. It is almost completely online and asynchronous. So almost all of the interactions are done throughout the year online. And it is we also take a PBL, problem-based learning sort of approach, where you are presented with cases or exercises, and amongst your peers online through the online discussion boards, you have to support and contribute to what each other are learning and posting. So that's the overall process. I say it's mostly online because in each term, there are a couple days where we do meet on campus for some in-person methods training blocks and for the PPI summer school. So just to go through what the program looks like, in the first term, there's the online introduction to participatory health research. which will give you the basics and basis of skills for how to involve members of the public in a participatory way. And then there will also be the first part of the methods, which is methods in PHR1, which is largely which gives you an overview of some of the most important participatory methods and allows you to try them out in person when we all come together for a 2-day training block. And then in the spring semester, we have methods 2, which continues on that and has a 2-day training block at the end of it. And also the advanced participatory health research, which is much more theoretical, which is an opportunity to deep dive into a lot of the ethical, philosophical, mechanistic, academic areas that underlie what makes participatory health research work. So we want you not just to know how to do it, but really understand the basis in theory for why these things, what are the mechanisms that allow these things to create better research outcomes. And then the final part of the program is the 2-day public and patient involvement summer school, which takes place in June every year. And that's on campus, in person, giving you an opportunity to work alongside existing practitioners, international experts. It's always attended about a third of the participants that attend that every year are actually patients or members of the public. So it's a really good way to get used to working alongside patients and patient experts who have been doing this for a long time also, and really hearing some inspiring stories from international patient participants as well. So that's about it. The entry requirements are that you have a level 8 or equivalent. So this is a graduate level diploma. And but we do take, so you have to have some sort of undergrad, or partial plus work equivalent may be accepted depending on the case. But generally, we're looking for someone who has at least an undergrad and who has some research experience or some understanding of research, because we're not teaching you how to do research per se. We're teaching you how to take those research skills you have and add patients and members of the public, and be able to do that in collaboration with those people. Beside the fees are at the bottom there. We are hoping this past year we had 50% fee reductions, and we're hoping to garner 50% fee reductions again. For any other information about this program, please scan the QR code or look at the School of Medicine website, or email ppi-ignite@ul.ie. Thanks so much.
Thank you, John. Really excited for this program, which is brand new. We're putting our first cohort through it and looking forward to their graduation in September. And I think it's very timely. It's very much patient engagement is very much high in the agenda for both the HSE and for the Health Research Board. I'm now going to hand over to Dr. Patrick Kiley, or Professor Patrick Kiley, who is our Director of Research, and he will talk us through postgraduate research within the School of Medicine. Thank you, Pat.
Good afternoon, everybody. I'm delighted to talk to you today about postgraduate research within the School of Medicine. So if we just move on to the next slide, please. Yeah, so I suppose, we have here in the School of Medicine a very innovative, collaborative learning experience, and there's many different stakeholders within that. There's a massive demand nationally and internationally for our graduates, and the graduates that are coming from our undergraduate programs that you've heard about in terms of our medicine and biomedical science, but also our postgraduate courses that you've heard about, like the Health Professions Public Health and Participatory Health. Okay, our graduates and external graduates have the opportunity to do postgraduate research here in the School of Medicine. We have very active research programs running, and those research programs are focused on areas that are really tackling global health challenges. Those areas include disease diagnosis, disease intervention, discovering novel treatment approaches, monitoring those treatment approaches, which is a really growing area of research at the moment. There's a lot more patients that we're trying to get into their homes. How do we monitor how they're progressing, how their treatments are working, etc. So that's a really big area at the moment. Also, of course, patient interventions, medical education, policy and government, and science communication. Okay, so we have research interests in all of these spaces. So if we move to the next slide, the key thing about how we get excited about research is that during your undergraduate programs or the postgraduate courses that we're running here, there will be opportunities to interact with researchers. That's people that are researching in their particular disciplines across those particular spaces. And people will get excited or interested in particular areas. For example, in the biomedical science space, you might become interested in an area of cancer biology, or maybe an area like neuron growth or new biomaterials or something like that, and you want to pursue further education in that. You'll have opportunities within all of those programs to interact with faculty and to discuss with faculty about postgraduate opportunities. Those postgraduate opportunities come in very different forms. Okay, there's funded programs where the faculty members will have research funding acquired from Research Ireland or from European sources or from charities, etc., to hire postgraduate students and get them to do PhDs or masters, etc. Another way is to self-fund those processes, whereby you might be working in employment and there's an opportunity to do postgraduate research part-time during your employment. So we have lots of different ways in and lots of different opportunities. But the key thing is that, to do postgraduate research, you have to be very, very interested in a particular space, and you'll become an expert in that space then as you progress through your PhD programs in particular. So the key thing is to interact with faculty. If you're interested in what we're doing here in the School of Medicine, for people on there who have degrees already, interact with the faculty, email them directly, ask them are there any opportunities available in their group. And also, if you have general inquiries, please send email to medicineresearch@duell.ie, and we will get back to you. Thank you.
Thank you, Pat. And thanks to all of our speakers today. Really appreciate your time and your effort and the fantastic presentations that you've done. For all of those of you who've joined us today as potential applicants, thanks for your time. For more information on any of the programs that we discussed today, you can click on the link and follow that right to any of our programs. But as Pat said, if you're looking for more information, you can also just go to as far as medicine, and you'll get links to all of our faculty and academic and clinical staff as well, and you can reach out to them if you have got specific queries in the areas of research. So to my colleagues from the Education and Health Sciences faculty, Lynn O'Doherty and Sinead Liston, thank you ever so much for setting this up and for monitoring our chat. If you have any final questions as an applicant, please get them into the chat and we'll be sure to respond. But get in touch either via the email addresses on the agenda, or apply through the CEO, or apply directly on the program's pages relevant to the individual program of interest. And we'd like to thank you for that. Thanks all, and take care.